Welcome to Roadmap to Residency. So, hello everyone, I am Abhiraz. Welcome to our Club 250 Matchmaker sessions, where we focus on the high yield of the high yields, the important of the importance. So here we have a question. So whenever you encounter a USMLE style question, as I always say, you need to read the last line first. So which of the following best explains the mechanism underlying the decrease in the stroke volume seen in this patient's condition? So a 65-year-old male with a history of heart failure presents to the cardiology clinic with worsening dyspnea and exercise intolerance. His medications include a diuretic and an angiotensin converting enzyme inhibitor. On physical examination, his blood pressure is 110 upon 70 millimeters of mercury, heart rate is 80 beats per minute, and lung auscultation reveals bilateral crackles. An echocardiogram shows a decreased left ventricular ejection fraction, and which of the following best explains the mechanism behind the underlying disease in the stroke volumes in this patient. So the stroke volume is decreased, right? Because the left ventricular ejection fraction is decreased. So here we have a person who has the left-sided symptoms, so that may be left-sided pathology, and then the left stroke volume is decreased. So what is the mechanism behind it? Increased preload, decreased preload, decreased afterload, increased afterload, or increased contractility. So to understand this question, you need to have idea about the heart failure, the types of heart failure, systolic or diastolic type of heart failure, and also about the Frank-Starling mechanism. So before we move on to that, we just discuss about some of the basics. For example, what is cardiac output? So cardiac output is stroke volume times heart rate, right? And in early stage of exercise, it is maintained by increasing the heart rate and increasing the stroke volume, okay? And in later stages, it is maintained by the heart rate only, the stroke volume plateaus. So a stroke volume is affected by the contractility, afterload, and preload of the patient, and it increases with contractility, preload, and afterload. And stroke work is the work done by the ventricle to eject the stroke volume, which is directly proportional to the stroke volume times mean arterial pressure. So falling heart has a decreased stroke volume. Okay, it may be systolic dysfunction, or it may be diastolic dysfunction. Here is our answer. The stroke volume may be decreasing due to the systolic or diastolic dysfunction. So moving on to the Starling's law, it says that the force of contraction is proportional to the in diastolic length of the cardiac muscle. So let me explain this concept. So for example, this is our left ventricle. The blood is entering from the left atrium towards the left ventricle. Then subsequently, there will be dilation of the left ventricle with the entering amount of the blood, right? There will be more and more blood in the left ventricle, and the left ventricle will just dilate, and at some point it will stop dilating, and this is the maximum dilation that the left ventricle can just go into. Now, the Starling's law suggests that the force of contraction is directly proportional to the in diastolic length of the cardiac muscle. Yes, there is limit. Okay, there is a limit towards contraction, and there's limit towards the dilation capacity. Then if there is just the limit is reached, then the force of the contraction will be maximum with maximum dilatation. Now this image you need to refer to with the Starling's phenomenon, right? Now it's in this picture we can see that, let me erase this all. So in this picture we can see that in case of heart failure, there is decrease in the myocardial contractility. So there will be ultimately decrease in the stroke volume. In case of exercise, there is increase in the contractility, there is increase in the heart rate, and there will be increase in the stroke volume. Now, this image, I want to show you that when the heart is normal, then the Starling's law come in place. Okay, then the Starling's law come in act. But when the heart is abnormal, then the Starling's law will just fail, because as we can see, if the heart is abnormal, even though in case of heart failure, there is, in some types of heart failure, there is an increase in the volume of the blood in the left ventricle. But since the heart cannot contract, okay, appropriately, then there will be decrease in the stroke volume. So you just refer this image in contrast with the Starling's law, okay. just here we can see in the normal rest, the when if the preload is more, okay, or the ventricular in diastolic volume is normal in case of normal heart, then there is normal dilation of the left ventricle, and there will be normal contraction, which is directly proportional to the in diastolic length of the cardiac fiber. And then there will be normal stroke volume that is happening. So we just need to com compare this graph with the Starling's law concept. Okay, the normal versus abnormal. So there we have the answer, that's the decreased preload. Now our patient has diastolic dysfunction. Okay, a decrease in preload it generally occurs with hypovolemia, right? But in heart failure there is volume overload also. But this is a sort of diastolic dysfunction. So if there is diastolic dysfunction, the heart cannot relax, so ultimately the force of contraction will decrease, right? Now the another option, that is the increased preload, and if there was an increase in the preload, then it will lead to an increase in the stroke volume as per the Frank-Starling mechanism. But this patient has and echocardiographic findings, which are indicative of heart failure, right? Where increased preload often occurs initially, but eventually contributes to the volume overload and worsening heart failure. So here we can see that preload is increased by increased central venous pressure, reduced heart rate, valvular regurgitation, increased aortic pressure, and ventricular systolic failure. The preload is decreased by the decreased central venous pressure, or increased heart rate, or ventricular diastolic failure, which our patient has. Option number C, that is the decreased afterload, is a decrease in the afterload or the resistance against which the left ventricle must eject blood can improve the stroke volume. However, this patient's blood pressure is relatively normal, 110/70 millimeter of mercury. So decreased afterload is less likely to be the primary cause. Increase afterload and increase in the afterload, such as in systemic hypertension or aortic stenosis, can reduce the stroke volume. However, this patient's blood pressure is not elevated. So the increase in the contractility can also improve the stroke volume. However, this patient's AC inhibitor and diuretic medications may reduce the afterload and preload respectively, but they do not directly enhance the contractility. Hope you enjoyed this video. We will be again back in the next one with the next super duper concept. Till then, keep studying hard. See you in the next one. Thank you very much.